Hi, I'm Dr. Rajani, and today I'm taking you into my clinic to show you how I, quote unquote, lift a face. I'm going to show you a patient. We're going to go through a treatment. We're going to do some biostimulators. We're going to do some threads and thread lifting. I'm going to also show you pictures of this 40-year-old 10 years ago to see what she looked like before, what she looks like today, and a before and after of the procedure, and even one of the half face at the halftime report so that you can see what she looked like on one side of her face treated and one not. Now, the purpose of this video is education for you. I'm going to go through skincare as well, but what you can see happens in a clinic, how I think, my thought process. It's not to show you how great I am or all these great results I get. I have my patients. I have over 10,000 patients. My practice is set. The idea is to give you an idea what you may or may not want to do. Even if you never want injections, the skincare and the concepts I'm going through will help you. Now, this is, like I said, it's a 40-year-old patient. So a lot of times people say, well, they don't need it. People don't need aesthetics. They want it. They desire it, and we're in the day of prevention. Be kind with your comments below, but we all learn from these comments. Just keep in mind, these patients are being seen by millions of people. They're putting themselves out there. Certainly critique me. I'm built for that. But your unkind comments, just write them down on a piece of paper. When you're done watching the video, throw them out. They're not going to help us. Your constructive comments, we always want to hear. And your thought processes on these videos. If you want to see more like this, let me know. And let's dive into my clinic so we can watch this now. Okay, so the purpose of this video is to just demonstrate threads going in, PDO threads. We're going to use two different types, and also a combination with Sculptra, a biostimulator. One of the questions we've been getting asked a lot is, can you combine things at the same time? The more you do at the same time is a benefit to the patient. In this case, for instance, the numbing from the Sculptra is going to help the threads that we put in because we're kind of in effect doing a nerve block at the same time, and to take people through exactly what a thread is, the different techniques, because the result is depending on who does your procedure and using the real quality products, not fake threads or threads that are going to break. So people say, I didn't like my thread lift. A lot of times it's inappropriate threads, poor threads, or inappropriate technique. So one of the things that leads to Sculptra nodules or problems that people don't think about, as simple as not allowing it to sediment. So you want to always disrupt it, shake it, stir it, but in order to do that, you have to have air in there. All these little nuances of Sculptra allow it to work properly. So, and you're like a machine, and you're very methodical at injecting. We're doing high cheek. You want to make sure it works, that the flow is good. You also, depending where the bevel is very important because we want to be on a very, very specific layer here. And of course, we have some lidocaine or numbing in here. I'm going to come in here. She wants a more prominent zygomatic bone. We want to come in, and we want to be at the exact appropriate layer. We've cleansed, including the hair. And then the layer we put it at is absolutely key. Now, she likes the other cheek more than this side because there's a little more volume on the other side. So I added a little more volume here, and we want the point of maximal light reflection. So what I'm doing is moving the tissues over the needle to then improve exactly the point of maximal light reflection. Now, here's a classic. So a little clog there, and I work through it. And here's where we want most of the fluid. I'm going to push the tissues over and inject a little more at that point of maximal light reflection, always looking for blanching of the tissues. And you can see the light reflection change right there. And then I'm going to come on the way out, knowing that my facial artery is below where I'm at, knowing as much as we can know. You can't know everything 100%. And again, I'm on the periosteal level, the key level here to create that. You know you're in the right level because I have what? Zero blood. This is a zero blood technique. And that means we were where we needed to be. And you can see that cheek. Now that's a biostimulator. I'll massage that down. But the key is we want to be on the right level with the right amount of product and get the light reflection in that anterior cheek, because we want this cheek to be as photogenic for her as the photogenic side she likes, which is her right. So we're approximating these two. So that's the Sculptra part. Now on the same side, because I have lidocaine in here, I'm going to use that to my advantage. I am going to put a little lidocaine with epi at the opening that I want. My goal is to kind of snatch this up at the jawline. You see, we got a little smile out of the patient when we said the word snatch that up. My whole day is made on snatching faces. People love that. So what I'm going to do, we'll come to the patient here. And in this case, I'm just going to, the further back we come, the more difficult our day is, because we got to navigate the cannula through the thread of the cannula through a perfect plane. There is zero tolerance for mistakes here. I'm just going to put a little poke here. Now this burn's going in. Sorry about a little burn.
No, okay.
But it does blanch a little bit where we have it. When we like that, it will know where our opening is. This is just a standard formation of our thread, a standard vector. You can get crazy. You can do reverse vectors through the hairline and up and different things. She looks great. Pretty much no jowling. We made that great cheek here. But now what I'm going to do is kind of come and create an opening with a larger gauge needle right where I put our lidocaine with epi. I want to show you one thing, because I am going to attach some lidocaine to my thread. So if I need extra numbing along the way of the tract, I can add lidocaine. But now what if I confused Sculptra for lidocaine? That's a bad thing. That's a bad day. That's a bad outcome. What do? I keep my 18 gauge locked on my lidocaine, so I always know this is my lidocaine. That's just what you do if you're methodical. And that's the problem with teaching injectors now and people not learning properly and trying to do this all in one day crash course. And so experience makes a difference, but make your life easier and become methodical. Your patient gets one face. She's depending on me to have a perfect day. If you're not going to have a perfect day, you don't show up to work. That's just how it goes. You want me to show up and not be perfect?
Oh gosh.
Never, right? So my job, unfortunately, is always be perfect. So, but I think that's a standard that you should expect. Okay, why not, right? Okay, so I'm going to go bevel down here. It doesn't much matter with this thread that we're going to use. And we have our nice towel covering here, and we've cleansed her several times. Now, this is the key of keeping the exact same plane, and I have her head positioned exactly how I want it. And I know exactly in my mind where I want to go to. I got a straight shot. Should I waver? That's a problem. So my job is, no matter what discomfort she's in, then my job is to make it comfortable. If she is in discomfort and she's moving around, I'm not going to get the result for her. My number one job is to get the product or the thread, and I can see where I'm at, in the right plane. My second job is to control her discomfort so I can get there. But if she flinches, you see where I'm bracing her. All those things are going to get the perfect result. I'm at the oral commissure now. If she's going to have tenderness, this is 100% where it is all the time. And I'm going to hold and I'm going to push through that zone. And I know that this might be an area where she might flinch. I'm prepared. And some people just come to that level and they don't go through. And I can go through to that level there. And then I'm going to grab it, I'm going to pull back, and the thread is here. It's not fully engaged. Was I correct? Did this hurt, or did you do just fine?
You did great.
Okay, see, okay, so far we're having a perfect day. Now, we're going to go for a bigger one. You ready for a bigger one?
Yeah, sure. Let's do it.
I'm just going to show what I do for people here in terms of the putting on some lidocaine for you. Again, I know it's my lidocaine because I have a large gauge needle on there. I cannot mess up. And so if I'm not thinking, at least my methods are thinking for me. Makes it kind of, I guess you'd use the word dummy proof, right? Why not? Now, this one here is that you can see a larger thread. I'm going to come through the same opening. I have not engaged these. And I'm going to, again, I want to be in a different plane than my last thread because the size of the thread. But there's much more tension on this thread. Now, if you see up here, I can give her a little shot. Now, I know I got to travel fluid all the way through there. You tell me if you feel, or when you feel a little burn. I want to know because I'm putting stuff in there. Feel anything?
Slightly.
Okay. You'll feel it in a minute. Cold or burn? Nothing yet?
Nothing yet.
We numbed you real good.
Yes, you did.
So there, I know we're infusing something right here because I can see. And I'm going to give her a second and I'm going to push through that. And that little tumescence here allows me to push through that. Now, I'm going to come straight shot and see my depth. I want a little deeper. I'm pushing. I'm manipulating the cannula all the way through so that I get the exact perfect depth. I can tell just there's a little discomfort here. I can feel it in her, and boom, I'm going to give her a little shot. You feel that? A little burn?
A little bit.
Yep. Great. Give her a second, move that, and I'm going to go through where I tumesced that. Boom, right there. You feel that click? Good. Okay, now I'm going to hold my thread. I'm going to pull out. So I've got 2 threads engaged. Now you can see the pull that I'm going to have. Let's go through what a disaster is. Can we talk disasters while you're still on the table? Okay, because you're not going to have one, so don't worry. But you can get puckering. Okay, that can not look good. You can use, this isn't a disaster, but if you take poor threads, threads that don't work, if you have threads that were oxidized, exposed to oxygen, came from different countries, traveled the wrong way to me, then as I push this, they can just crumble in the hand. So good threads, I can push as hard as I want. This won't break. You can see all the tension on there. And then, of course, being in the right level, some didn't go in the mouth, in the parotid, in all of the structures, the facial nerve that we don't want. Now, while we're on this side, I might as well clip this just to show you. Here's another potential problem that occurs with so many people is just simply burying this thread. So you need to push down and have enough tension to where there's a little pucker there. I can clip and not the skin, but then I'm going to bury that thread. If not, you have a problem right there, and that's a hard one to fix. So all of those steps, plus about 20 more that are intuitive that I didn't talk about, are important to get what we got for her, which is high cheek here, a snatched lower area here, and just pull up the skin at that oral commissure. Now she'll build collagen around here in an upward manner. Part of our post-care is stay as still as she can without a lot of smiling. Depends who you're dealing with in terms of how long they can deal with it for. You don't want them to go eat a big burger or smile a lot for. It's really nice for 7 days, 5 days, whatever they can do, up to 2 weeks. But that will sit there and grow the collagen in that upward manner. That thread will dissolve anywhere in about 3 to 5 months. But of course, the collagen building around it is going to stay years. So that is one side of her face. The other side of the face, we're going to charge double because we need to make a little extra money here today.
You told me not to smile.
Yeah, she can't smile. That's so terrible. Doctor telling the joke. Before we get to the before and after pictures, you'll want to know about a website I created, a questionnaire, quizmd.com. When you go there, you'll answer a few questions about yourself, about your goals, and you'll get an answer of a skincare routine, things you can do at home if you don't want to have procedures done, or something that goes along with the procedures you're having done that's tailored to exactly what you're going to want to do. I'll put a link at the end of this video and also in the description below so you can go directly there if you wish. The more you do at home, the less you have to do when you're in clinic, and also the better the treatments will be, the less it will cost you. Okay, so we take a look here. This picture on this side was from 10 years ago, before we started doing any work. This picture here was about 3-4 years ago, I believe, and this one here is from today. So if we look at all these pictures, I think one thing we're looking at is facial shape. And one of the reasons that we age is more fat, more descent in the lower face, and we become square. And you can see that well demonstrated on this side. I'm going to remove the markings so you can see how there's a wider chin here, and we've created that narrow look. I think the other thing to see, of course, is we talk about lip volume over the years. Now, these were just done just less than 7 days ago. This swelling will come down nicely. Remove those markings. You can also see the skin is maintained vibrant. And the idea is over time, if you're with a great practice where people are seeing you over time and they're treating you and they're reassessing every single time, along with what your journey wants to be, you can then create things over time the way you want it to be, knowing the starting position here, the mid position, and today where you go, okay, well, this is what I want. This is what I liked. This is what I didn't like. So I'll let you look at those before and afters, and you can determine the factors that you like. Of course, we just put about 2 to 2.5 cc's of volume in the upper cheeks with biostimulators, knowing that that will settle down. If you guys like these videos, of course, and you want to see the result of the after, say a month or 2 or 3 after, when everything settles in, then we can relook at it. But the idea is, 10 years ago, roughly 5 years ago to today, you want to not age. You want to somewhat age in reverse and maintain. And of course, styles change. So where larger lips were in a little bit, they're still in a little bit. It might be that over time you want to not treat them and let them reverse. That's the beautiful thing of using products that are not actually permanent. You can change kind of your mindset and your style based on that. I think the other thing to note is just maintaining upper face volume and the under eye and cheek fat pads. Could we add a little bit of temple up here? For sure. So these pictures are all from today. And here you can see this is the before. I know you're all distracted by the lips. Just let that one go. They were just done. They will settle in. We can do a follow-up if you want. What we're looking at is particularly, say, the cheek and along the jawline down in this area. Of course, you'll have some swelling, but you see the volume we added in the cheek. What I want to show in this center picture is one side that was done, that was treated, and that is this side on your screen, the right side. Look at the difference. If you can cover it in half and you think about this side on her, let's go on your screen's right. Look at the cheek, look at the under eye, look at the edge of the lip. I'm going to then remove the markings, and then you just look at the lifted side versus I'll put an N here, the non-lifted side. Obviously, this is exaggerated with 2 cc's of fluid, but the idea is that biostimulator will kick in. It's creating also a little more of a hollow look here than what most people might want. But again, that settles in. But I wanted you to see what one side looked like. And of course, we had the threads done in that lower side too. One of the things you can see is, you see this like a jowl by the edge of the mouth on the untreated side? And look where we put the thread. It just lifted this whole area up on this side. So it gave that kind of snatched look. And then here, when we treated both sides on this picture, you can then see this side lifts up, but also look at that area down by the edge of the mouth. A lot of people call it the RBF when it's more down at the oral commissure, but that little pooch of fat that's right there is often hard for people, and it accumulates to an aging look if you maintained it. But you can see how we reduce that by putting the thread through that in that vector, and then of course added some volume here. You're going to see an asymmetry from side to side. Now, why is that? Because we put in a water-based biostimulator in terms of Sculptra. Because of that, the water is going to flow in different areas before we massage it. But it will all even out. I guess it would be interesting if I showed you a 1 to 4 month follow-up. But this is what happens when you come in yearly. For 5 to 10 years, you maintain the look as we're seeing from the actual before and after from the 10-year follow-up. But this is all same day, non-treated, half-treated, and full. So you can analyze these and make of it what you will. Maybe it'll be fun to do another 1 to 2 year follow-up when she comes in next year for appointment. But let's move on in the video. Okay, let's go on to the patient's other side, the photogenic side that she liked. We're going to use different amount of volume here, as well as the depth and technique will be a little bit different. After this, we'll hear from the patient. What does she think of the result? Was it painful? And she'll let you know some information from her perspective, should you want something like this done for yourself. Okay, so we're going to use, this is our second side. We finished her left, we're on her right. And using Sculptra as a biostimulator, you'll notice all the things I'm doing intuitively. I'm feeling what I'm doing here is I'm feeling the bone. And the interesting thing is, as a female ages, she's very young and youthful, has a nice bone here. As people get older and lose estrogen, lose bone, this gets very narrow. But I'm going to come down. I want to be on the periosteal level, we call it, the bone. And bone does, in fact, hurt. So you just always slightly touching the bone. But you want to, there you go, I could see that we're on it. And then the flex is really important and the point of maximal light reflection. And what's important about this is knowing the bone allows you to know your anatomy of which fat pad, where you're at, and also knowing the anatomy, the artery coming in front of the ear and the facial artery, the transverse one that runs below where I'm at. So anatomy is key, and certain layers have less chance of having the vessels, but also with a biostimulator like this, I want to make sure that I'm on the bone, because what I'm doing is I'm playing off of her beautiful bone structure to maintain it and keep it. I could be in the fat layers, but for what she wants to achieve and the light reflection we want, this is the layer we want to be on. So the layer people are on when they inject is oh so important. And sometimes I see people injecting layers. It not only scares me, but I know the patients aren't going to get the result. So while Sculptra, where you're at, how you're injecting, and how you look at each different face determines what you're going to get for result. Now, this is our Sculptra. You can see there's hardly any bleeding. So we avoided all major structures. I'm going to come in, we're going to do some PDO threads. Now, often you're going to hear people talk about threads and Sculptra and say, oh, you can't get a facelift if you get threads or Sculptra. While it's good to wait a year after getting threads or Sculptra before a facelift, there's no problem. Many people get them. Many of my patients have had facelifts, especially after the age of 60. They just want a surgical lift versus non-surgical. They may have had 10 or 20, even 30 vials of Sculptra over the years, and there's never been a problem. So it does create collagen type 1 and 3, and some surgeons will tell you, yeah, the facelift procedure might take an extra 15 or 20 minutes, but understand there's a lot of fear being given to you, and a lot of people have their interest in mind. It's a very competitive industry. So here are our two threads, and you can see the pull that we get, and it's not giving. That's how strong the threads are, and the barbs are on the threads. You can see that pull. I'm just going to engage the threads how I want them, and I'm feeling it just click and ratchet up the face. And this is really what's bothering everyone. So we took care of that. That's gone. What would we call it? The downturned mouth, the RBF. I mean, all day long, that's all I'm hearing. People don't like this downturn. There's many ways to address it. How was the discomfort?
Easy.
So people know.
You got this.
You have it, not me. It was painless for me, by the way, just in case you want to know. But it's literally, a lot of people say threads are the most painful thing I've done, but it's up to the practitioner to work with the client. Everyone has a different pain level. And today it might not have been painful. You might come back on a different day for different reasons. You might have a little more discomfort, and it's my job to manage that.
I feel so good. I'm in the same place.
You wanted a little pick-me-up, right?
Yeah,
Okay.
I got it.
And you got it? Do you feel good?
So good. This is insane.
Is that what you wanted? A little pick? You wanted? We lifted you. We lifted you today.
Snatched a little bit.
I've never had anyone complain about lift in my career. That's one thing no one ever complains about. I got a little lift.
Oh my
So-
gosh, you did amazing.
So feels okay. This is
Feels
just a
great.
bit of Sculptra massage for you. You're going to do this at home, just a couple for you, for this area of what you had done a couple times a day for a few days. It doesn't have to be, don't have to be too vigilant on it because of the layer I went and how I did it. But it's nice, and you can massage it in an upward fashion. 2 minutes twice a day for this. Everyone is going to say, oh, 5, 5, 5. every face is different. Every person is different. I'm putting it at this layer. It's not the standard 555 that you're going to do. But that is going, those biostimulators up here are going to pick up and lift. It is a skin tightener. You will get some volume. And of course, take care of my threads down there, girl. Take care of these. You're now, I've done my job. Now you have to do your job.
Question.
You have part of the deal. Yes.
Threads, I don't want to touch or massage or rub them, correct?
Correct.
Okay.
You're the only, grab that mirror.
Okay.
What you're going to do is come up through here
Okay.
and come up through here. And how you're going to maintain your skin, alpha hydroxy acid, retinol wipes, my Ultra Moisture. If you want a little lip enhancer, you can do that. That's optional because we know you're not getting vertical lip lines. We're never going to let that happen.
No.
And you're going to use a nice new cream that we're going to send you that we're releasing not till January. So you have to keep it hush hush, but you're going to love it. But you can't tell anyone about it. It's going to come in an unlabeled canister.
Okay.
So
I'm excited.
I can reveal the ingredients to you, but you can't talk about them.
Okay, I won't. I won't.
And I know you're a great patient, so we don't have to get you to swear on anything.
Those are so-
I know, because I give you all the inside stuff. Excellent. But that's biostimulators with threads, and you can see if there's other things that need doing on the same day, it's very possible to do. The more we do on the same day, the less she has to come in, the more she's living life and enjoying her journey. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant. You're now going to want to watch this video on a simple blueprint skincare routine you can do at home, and one down here on a DIY under eye treatment, so you don't have to come into clinics and get anything done should you not want to. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.